NCM-102. Health teaching about hyperthyroidism.
Okay, Mom, before we will start, let's us put ourselves in the presence of God. Let us pray. Our Son, Holy Spirit, Amen. Our Father who art in heaven, hallowed be your name. Kingdom come, will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. Lead us not into temptation, but deliver us from evil. Amen.
The Father, the Son, and the Holy Spirit.
Hi, Mom. Good morning.
Good morning.
So, by the way, I'm Ken Tarvivicho. I'm your student nurse for today. So, I'm going to discuss with you about hyperthyroidism. So, you have any idea about hyperthyroidism or any clue what is hyperthyroidism?
I think hyperthyroidism is having too much thyroid hormone.
Exactly. So, now I'm going to discuss with you the background of hyperthyroidism. So, what is hyperthyroidism? So, hyperthyroidism is a condition where the thyroid gland produces excessive amount of thyroid hormones. As what you said before, it's a primarily thyroid. It's the primarily thyroxine, the T4, and the triiodothyroxine, the T3. This hormone regulates the body's metabolism, and when it produces in excess, they can speed up many bodily function. So, just an overview of the thyroid gland. So, this is the overview of your thyroid gland. So, the thyroid gland is small butterfly-shaped gland located at the base of the neck. So, as what you can see from here, it's just down below of your Adam's apple. So it plays a crucial role in the body's endocrine system, which is responsible for producing and regulating hormones that controls various physiological processes. So this is your thyroid gland produces hormones. So the thyroid production of T3 and T4 is controlled by feedback loop involving the hypothalamus and pituitary gland. So, so starting from the hypothalamus, release thyrotropin releasing hormones, the TRH, which stimulates the pituitary gland. So the pituitary gland releases thyroid stimulating hormone, which is the TSH, which prompts the thyroid gland to produce and release T3 and T4. So as level of T3 and T4 rises, they provide feedback to the hypothalamus and pituitary to reduce TRH and TSH production, ensuring hormones level remains balanced. So what is the thyroid function? So the thyroid gland primarily produces two hormones. So which one is, I just told you, the T4 and the T3, which is the thyroxine and the triiodothyronine. So let us proceed to the thyroid function. So there are two hormones from our thyroid gland, which is the T4 and the T3. So the T4 is the thyroxine and the T3 is the triiodothyronine. So the T4 is the most abundant thyroid hormones but less active, and the T3 is the more active hormones, and which is the responsible for regulating the metabolism. So this is what is the role in our endocrine system. So the thyroid hormones, the T3 and the T4, regulates several critical bodily functions, including our first is the metabolism. These hormones control how quickly the body uses energy, then converting oxygen and calories into energy. Balanced metabolism helps maintain body weight, temperature, and overall energy levels. So in the heart and cardiovascular system, the second one is the heart and cardiovascular system. Thyroid hormones influence heart rate and strength of heart contractions, ensuring efficient blood flow through your body. The third one is development and growth. The thyroid hormones are crucial for the normal growth and development of children, especially brain development during infancy and childhood. And temperature regulation. Thyroid hormones help maintain body temperature by controlling the rate of heart production in tissues. And it's also a productive system. It's a proper thyroid function is essential for reproductive health, including the regulation of menstrual cycle in women and sperm production in men. So, thyroid imbalances. So the hypothyroidism, thyroid imbalances. So in hypothyroidism, when the thyroid does not produce enough T3 and T4, resulting in slower metabolism, weight gain, fatigue, depression, and sensitivity to cold. While the other one is the hyperthyroidism, as mentioned earlier, an overproduction of thyroid hormone leads to a faster metabolism, weight loss, anxiety, and increased heart rate. So, what is the causes of hyperthyroidism? So, this is the causes of hyperthyroidism. First is the Graves' disease. Graves' disease. So, what is Graves' disease? This is autoimmune disorder is the most common cause of hyperthyroidism. The immune system produces antibodies that stimulates thyroid to produce too much T4 and T3. So thyroid nodules. The second one is thyroid nodules. Overgrowth in the thyroid glands known as nodules can lead to increased hormones production. This can either be benign or become a more serious condition. So third one is the thyroiditis. This is the inflammation of the thyroid gland can lead to the leakage of stored thyroid hormones to the bloodstream, temporarily causing hyperthyroidism. And the fourth one is the excess iodine intake. So this is the one consuming too much iodine through diet, medication, or supplements can overstimulate the thyroid, leading to excess hormones production. Pituitary gland malfunction. Rarely, tumors in the pituitary glands can cause excess TSH production, which stimulates the thyroid. So this is the risk factor of thyroid disorders. The gender. Women are more likely than men to develop thyroid disorders, especially during time of hormone changes like pregnancy or menopause. Menopause, I mean. So age as well. The risk of thyroid issue increases with the age, particularly after age 60s. Family history. So if you have a family history of thyroid disease, increases the risk of developing both hyperthyroidism and hypothyroidism. So this is for like a family history as well. And the other one is autoimmune disease, a condition like type 1 diabetes, rheumatoid arthritis, or lupus. Increase in the likelihood of developing thyroid disorder, particularly Hashimoto's or Graves' disease. Radioactive exposure. Exposed radiation, in particular to the head, neck, or chest, to radiation therapy or environmental exposure can damage thyroid gland. So if you are exposed to radiation and iodine intake, both excess iodine and iodine deficiency can increase the risk of thyroid dysfunction, with excessive intake potentially leading to hypothyroidism and deficiency causing to hyperthyroidism, like taking seafoods, fish, seaweeds, this kind of things. For the fruits as well, pineapples and strawberries, exactly. And for pregnancy, some women develop thyroid issues during or after pregnancy. This can be temporarily postpartum thyroiditis or long-lasting hypothyroidism. So this is the common symptoms and clinical presentation of hyperthyroidism. So weight loss. Despite an increased appetite, individuals with hyperthyroidism often lost weight because of an accelerated metabolism. And we have also increased appetite. A heightened metabolism typically lead to an increase in appetite, but the weight loss persists due to rapid energy expenditure. And we have also the rapid or irregular heartbeat. Hyperthyroidism can cause tachycardia, rapid heart rate, palpitation or arrhythmias, irregular heart rhythm including atrial fibrillation, nervousness, anxiety, and irritability. The increased level of thyroid hormones can overstimulate the nervous system, leading to feeling of nervousness, restlessness, anxiety, and irritability. We have as well the tremors, fine trembling or shaking of hands. Can feel that one, no? If you something on this one. Hands and finger in common due to overactivity of nervous system. Heat intolerance and excessive sweating. Individuals often feel unusual warm or sweaty, even in cold environment, as their bodies produce more heat due to increased metabolic activity. Fatigue and muscle weakness. Paradoxically, despite hyperactivity, individuals with hyperthyroidism may feel fatigue, muscle weakness, particularly in the arms and thigh is also the common things. Changes in bowel habits. Hyperthyroidism can lead to more frequent bowel movement or even diarrhea due to increased gastrointestinal motility. And we have also the menstrual irregularities. This is mostly common for the women. Women may experience lighter or less frequently menstrual period, and in some cases, hyperthyroidism can lead to amenorrhea, which is the absence of menstruation. Goiter. An enlarged thyroid glands or the goiter may be visible or palpable in the neck. This is the more common in case of grave disease or thyroid nodules. And we have also the eye problem or Graves' ophthalmopathy, specific to grave disease, or some individuals may develop eye symptoms such as bulging eyes, exophthalmos, eye irritation, sensitivity to light, tearing or double vision. There was well the sleep disturbance, difficulty falling or staying asleep is common due to increased nervous system activity and heightened energy level. Thinning hair and skin. Hair may become thin, brittle and fall out more easily, while skin may become thin, warm and moist due to increased sweating. And we have also the increased heart rate, which is the tachycardia. It is a consistently elevated heart rate, often over 100 beats per minute. It's a hallmark of hypothyroidism. We have also the emotional changes. Some individuals may experience mood swing, irritability or depression, likely related to the excessive thyroid hormone stimulation. So this is the severe complication if untreated. Thyroid storm. This is the rare but life-threatening condition where symptoms become extreme, including high fever, rapid heart rate, confusion, and even heart failure. It usually results from untreated or poorly managed hyperthyroidism. So we have also the heart issue. Prolonged hypothyroidism can lead to heart problems, including atrial fibrillations, which increase stroke risk, and congestive heart failure due to sustained high heart rates. So what is the diagnosis of hyperthyroidism? So the diagnosis of hyperthyroidism is the blood test. So for the diagnosis of hyperthyroidism, we have the blood test. It's a blood test for TSH, the thyroid stimulating hormones levels, which is the T4 and the T3 levels. We have also the imaging, which is the radioactive iodine uptake, the REIU test. We have physical examination, which is sign of goiters of normal thyroid gland. So this is the complication of hyperthyroidism. We have the heart problem. So first is the atrial fibrillations. Atrial fibrillation is a rapid irregular heartbeat that can increase the risk of stroke and other heart-related complications. So we have also the congestive heart failure. The heart struggles to pump blood effectively due to increased strain, leading to fluid buildup in the body. We have as well the rapid heart rate, which is the tachycardia. It is constantly elevated heart rate can lead to long-term cardiovascular issues. We have this also. The second one is the bone health and osteoporosis. Excess thyroid hormones can interfere with the balance of calcium and other minerals in the bones, leading to osteoporosis, or other term is weakened bones, which increase the risk of fractures. The third one is thyrotoxic crisis, or the thyroid storm. This is a rare but life-threatening complication where thyroid hormones levels spike suddenly, causing a rapid increase in heart rate, fever, sweating, confusion, and agitation. It requires immediate medical treatment and can be triggered by infection, stress, or discontinuation of hyperthyroidism medication. Fourth one is eye problems or Graves' ophthalmopathy. In people with Graves' disease, hyperthyroidism can lead to protruding eyes, dry irritated eyes, double vision, and even severe cases vision loss. This condition may require additional treatment with medical or surgery or radiation therapy. The fifth one is mental health issues. So hyperthyroidism can lead to anxiety, irritability, mood swing, and sometimes depression, especially if left unmanaged for a prolonged period. Hyperthyroidism. Following treatment, main hyperthyroidism treatment like radioactive iodine or thyroidectomy often result in hyperthyroidism, underactive thyroid, necessitating lifelong thyroid hormones replacement therapy. Muscle weakness and wasting. Untreated hyperthyroidism can lead to muscle weakness and even muscle wasting, loss of muscle mass, which can impact mobility and quality of life. Infertility and pregnancy. Number 8 is infertility and pregnancy complications. Hyperthyroidism can cause irregular menstruation cycle and may reduce fertility for the ladies. For pregnant women, untreated hyperthyroidism can increase the risk of preterm birth, low birth weight, preeclampsia, and thyroid issue in the baby. So, ninth one is skin issues or pretibial myxedemia. In Graves' disease, a rare skin condition called pretibial myxedemia. This is a rare condition called pretibial myxedema can develop, causing sweating, thickening of the skin, usually on the shins and the feet. Third one is the increased metabolic rate complications. Rapid metabolism can lead to unintentional weight loss, fatigue, and intolerance to heat, which can be physically exhausted and affect overall well-being. So the treatment options for hyperthyroidism is, first one is that we have the anti-thyroid medication. These medications like metimazole or the tapozole and propyl. First is we have the anti-thyroid medications like metimazole and PTU helps to reduce the production of thyroid hormones by the thyroid glands. They are commonly used for mild to moderate cases or a short-term solution before more permanent treatments such as surgery or radioactive iodine. Second one is radioactive iodine therapy. So these treatments involves taking radioactive iodine orally, which is absorbed by the thyroid gland. The radiation destroys the overactive thyroid cells, reducing hormones production. And it is permanent treatment but may lead to hyperthyroidism, requiring long-term thyroid hormones replacement therapy. The third one is the beta blockers. Beta blockers such as propranolol do not treat the underlying hyperthyroidism but help control symptoms like rapid heart rate, tremors, and anxiety. They often used in conjunction with treatment to manage symptoms until thyroid hormones level are normalized. Yeah, the fourth one is the thyroidectomy surgery. In some cases, surgical removal of thyroid glands, which is the thyroidectomy, may be necessary, especially if there are large goiters, if radioactive iodine is not option, or if the thyroid cancer is suspected. Surgery is more commonly recommended for those who do not respond to other treatments and have severe symptoms or have thyroid nodules. So the fifth one is lifestyle changes and monitoring. So reducing iodine intake, managing stress, and following a diet that supports the thyroid health can help manage symptoms. So regulating monitoring through blood tests and follow-up visit with an endocrinologist is essential to ensure treatment effectiveness is not just needed. So that's all for hyperthyroidism. So do you have anything to ask or some clarification about hyperthyroidism? So this is the food that you need to avoid, like seaweeds, seafoods like fish, and for the fruits, you need to avoid as well the cranberries, the pineapples, and strawberries.
Okay.
Okay, Mom, you have any question about hyperthyroidism?
Yeah, I have a question. How does hyperthyroidism affects the body?
Okay. Hyperthyroidism happens when the thyroid gland makes too much thyroid hormones. This condition also is called overactive thyroid. Hyperthyroidism speeds up body's metabolism that can cause many symptoms such as weight loss, hand tremors, and rapid irregular heartbeat.
Okay.
So, any question?
Yeah. Is hyperthyroidism life-threatening?
It's rarely an undiagnosed or poorly controlled overactive thyroid can lead to a serious life-threatening condition called a thyroid storm. This is sudden flare-ups of symptoms that can be triggered by an infection.
Okay.
So, any question?
Can you live a normal life with hyperthyroidism?
In general, people with hyperthyroidism have a good quality of life, with no particular limitation in terms of diet, exercise, work, or sexual activities. During the activity symptomatic phase of hyperthyroidism, the medical team may recommend avoiding strenuous physical exercises.
Okay. Another question. What habits cause hyperthyroidism?
The habit that causes hyperthyroidism is consuming excess iodine.
Is it okay to leave hyperthyroidism untreated? I-close pa mo na i-close dahil para makita pa mo.
So, ito yung question?
Is it okay to leave hyperthyroidism untreated?
If hyperthyroidism isn't treated, it can cause some serious health problems, including an irregular heartbeat that can lead to blood clots, stroke, heart failure, and other heart problems. An eye disease called Graves' ophthalmopathy. It can cause double vision, light sensitivity, and eye pain.
Okay. Another question.
Mhm.
Can stress trigger hyperthyroidism?
Moreover, hyperthyroidism is also a thyroid problem, but it is not caused by stress. But that doesn't mean that stress and hyperthyroidism are not connected in some ways. If you already have hyperthyroidism symptoms, physical or mental stress can make them worse.
Okay. Another question. What is the best medicine for hyperthyroidism?
We have the best medicine for hyperthyroidism is the radioiodine therapy.
Okay. So what is the drug of choice of hyperthyroidism?
Okay, so the drug of choice of hyperthyroidism is we have what we have this the PTU, or the other name is the propi, propylthyros propylthiouracil. Yeah, exactly.
Okay, so last question. Okay, last question. Is coffee bad for hyperthyroidism? Because I always drink coffee.
Actually, the food and beverage that contains caffeine, such as coffee, tea, and soda, and chocolates, can exacerbate the symptoms of hyperthyroidism.
Okay. So that's all.
Okay. Okay, ma'am, I'm going to evaluate to you about our topic about the hyperthyroidism. So I'll give you a quiz. If you learn something about my discussion.
Yeah, sure. No problem.
Okay, ma'am. So can we start?
Yeah, sure.
Okay. I'll give you some quizzes. So, ma'am, I'm going to start the quiz. So the first question is, it is a condition where the thyroid gland produces excessive amount of thyroid hormones. It's primarily the T3, T4, and the T3. What do you call for this one? Again, I will repeat. It is a condition where the thyroid gland produces excessive amount of thyroid hormones, primarily the T4 and the T3. So for the second question, are you done, ma'am, for the
Yes,
first question?
yes, done.
Okay. For the second question, it is small butterfly-shaped gland located at the base of the neck, just below the Adam's apple. Again, I will repeat. It is small butterfly-shaped gland located at the base of the neck, just below the Adam's apple.
Okay, then.
So for the third question, what are the two hormones produced by the thyroid gland? Again, I will repeat. What are the two hormones produced by the thyroid gland?
Okay, done.
Done. So for the fourth question, can you give me at least three causes of hyperthyroidism? Again, ma'am, I will repeat. Can you give me at least three causes of hyperthyroidism?
Okay, done.
Done?
Okay.
Done, ma'am?
Yeah, done.
Okay, so for the fifth question, what are the risk factor of thyroid disorder? Again, I will repeat. What are the risk factor of thyroid disorder? Would you like me to repeat the question again, ma'am?
It's okay, no need. Okay, next.
Finish?
Yeah.
So for the sixth question, give at least 10 common symptoms of hyperthyroidism. Again, I'll repeat. Give at least 10 common symptoms of hyperthyroidism.
10.
Yes, common
10.
symptoms. I'll give you two bonus question answers. One is eye problem, and the other one is tremors. Two bonus answers. So you have a little bit idea what is the common symptoms. You done, Mom?
Not yet.
You want me to repeat again the question?
No, it's okay.
It's okay. Did you get the question?
Okay.
Okay, finish.
Done.
Okay, for the last question, give at least 3 treatment for hyperthyroidism. Again, I will repeat. Give at least 3 treatment for hyperthyroidism.
Yeah, it's done.
It's done, Mom. Okay, I will check your answer. If is it correct, let me check. So for the first question, it is a condition where the thyroid gland produces excessive amount of thyroid hormones, primarily the T4 and the T3. The answer is hyperthyroidism. You're correct, Mom. So for the second, it is a small butterfly-shaped gland located at the base of the neck. Your answer is thyroid gland. Yes, it's correct. I think you're really listening, Mom, for my discussion. So for the third question, what are the 2 hormones produced by the thyroid gland? Your answer is T3 and T4. Yes, it's correct. You got the correct answer.
Yay!
So for the fourth one, can you give me at least 3 causes of hyperthyroidism? Your answer is grave disease, thyroiditis, and excessive iodine intake. Yes, correct. And for the fifth one, what are the risk factor of thyroid disorder? Your answer is radiation exposure, iodine intake, and pregnancy. Yes, it's correct as well. And the sixth one, give at least 10 common symptoms of thyroidectomy, thyroid disorder. Your answer is weight loss, rapid irregular heartbeat, anxiety, irritability, tremors. Yes, correct. Fatigue and muscle weakness, eye problems, sleep disturbance, menstrual irregularities, tachycardia, and thinning hair and skin. Yes, perfectly correct.
Yay.
And the last one is give at least 3 treatment for hyperthyroidism. You give it anti-thyroid medication, beta blockers, and thyroidectomy. It's perfect. You got the correct answer, Mom.
Yay!
It means you're really listening to my discussion. So furthermore, okay, Mom, we are done with the discussion about hyperthyroidism. So I think you know already what is hyperthyroidism, what is the cause,
As per evaluation.
as per my evaluation, and you got the perfect score. So thank you for your time, and that's it.
Okay, thank you, sir, for this discussion, and I really understand what is hyperthyroidism.
Okay, Mom, thank you.